Good evening, everybody. Welcome to the Future of Health Conference. It's really glad to have you here, and we thank you so much for joining us and for coming in very early. We appreciate all of you for your presence here today. It promises, as I'm sure you expect, to be a very engaging conference today, and we look forward to all your contributions, questions, and comments as we go on in the conference today. My pleasure to welcome you here alongside my co-host. My name is Wemimo Adewuni, and I've got here the very amiable. Go ahead.
Good morning, everyone. My name is Chubike Alaboso. I work with Nigeria Health Watch.
All right, great to have you here. As I said earlier, we'll have engagements with you, and so we look forward to you engaging with us. We have our online platform that will be open at strategic times, open to take your questions, your comments, and your contributions. We look forward to them. We have our online platform. We have those joining us online, and we also want to welcome all of you from across the world. Thank you for joining us. We'll be reaching out to you to take your questions and comments also as we go ahead. Before we begin proper, we'd like to take a safety message from Lagos Continental. This is to give you awareness about escape routes in case of an emergency. This is a health conference, and so we take your health and safety very seriously. So please help me welcome Mr. Walter from Lagos Continental as he comes to give us a brief about security measures around here. You're welcome, please. A round of applause, please. Thank you.
Good morning, ladies and gentlemen. My name is Walter Kerema, Health and Safety Officer of Lagos Continental Hotel. You're welcome to Lagos Continental Hotel, and thank you for choosing Lagos Continental Hotel. At any point, the fire alarm is triggered or evacuation is needed, please do not panic. Do not run, but walk through any of the exit doors quietly. And while at the foyer, you would be led through the doors that leads you down to the 0th floor. There, our officials will lead you to the assembly point. Please do not try to use the elevators because all will be grounded. And when you decide to use the foyer, it could also lead you to the ground floor. Lastly, for your own privacy, there are no cameras in this place and in the restroom. Guide your personal belongings and do not leave them unattended. Thank you once again for choosing Lagos Continental Hotel.
Thank you very much. So as with safety instructions on air flight, most people listen with their subconscious mind. So I'm going to ask you, what did he say about what escape routes can you use? Who wants to tell me? I want to know if you were listening. Anybody? Mr. Walter, they didn't hear you. What did he say? Anyone? Okay. What did he say? The stairs. Which way to the stairs now? Oh. What did he say about cameras? You heard that one. All right. So to escape, if there is an emergency, don't use the elevator because they would all be grounded. You head towards the stairs. What direction is that, Mr. Walter? This way. You see the light pointing over there. Head in that direction. Leave your belongings behind and save yourself first. We believe there will be no emergencies around here. All right. So welcome here. We welcome you dearly and will be mentioning you as we progress in the conference today. As we begin proper, we'd like to open with the national anthem. very much. You may be seated.
Thank you, everyone. Before we get started, we want to do a little exercise. We all know there was a reason why we all left our homes, our different places of work to attend this event today. You had an expectation, you wanted to get something out of this. So we want to be able to say we met your expectations or we were not able to meet some of them and find ways to let us please let us know through that link. If there are any issues, please let us know and we'll try and sort it out for you. Thank you.
While you feel that, I saw people taking very beautiful pictures earlier on. If you're sharing your pictures online, we'd love you to engage with us on Twitter and use the hashtag PS4HealthNG. PS4, number 4, HealthNG. That's private sector for health. PS number 4, HealthNG. Please use the hashtag as you post on social media so we can see your post. Thank you. And if you're finding it difficult to scan the QR code, we'll share, you can go to menti.com. You can see right there on the screen, menti.com. Okay, my eyes. It's menti.com, and you can use the code 62640316. So if you go to menti.com, it requires a code. If you type in the code 62640316, it takes you to the form that we need you to fill. Thank you all.
Thank you so much. We have 42 responses so far. We need to get up to 1,000 before we can proceed. If we don't get up to 1,000, we're not moving ahead. Thank you. That's fast. From 42, I'm looking back and I'm seeing 70 now. That's awesome. 73. We're counting. We're getting to 1,000. Let's keep going. That's the only one. Great. We're at 101.
110. Yeah, you're doing good. Thank you all for filling the forms. And please, if you haven't, please go ahead to fill it. Like Chibike said, would love to know your expectations from this conference. Would love to know afterwards if they were met, because we'll try to make it better for next time. So we expect your feedback on that link.
While we are on it, we'd like to proceed. The links are open, so you can still scan the QR code and go to the website and put in the expectations. But we'll go ahead while we continue to put in those expectations. As we all know, or some of us know, I don't know how many of us that are coming in contact with Nigeria Health Watch for the first time, but we are a health communication and advocacy platform, non-profit based in Abuja, Nigeria. As the name implies, it's watching out for the health of Nigerians. So we have lots of ways that we're able to, do that. Our editorials, our communications, events like this where we bring in the people who are doing this work. Because it's easy to do your work in your own silos, those working in Abuja, Kano, introduce Nigeria Health Watch using a video, so you also get to just a tiny bit of what we do. You get to understand it more. But of course, we are here all day. Feel free to reach out to us, to talk to us, to visit our website, to learn more about our work. This is just a snippet of what Nigeria Health Watch is. I think.
Nigeria Health Watch is a non-governmental health communication and advocacy organization that seeks to advocate for better healthcare for all Nigerians. We are guided by the belief that health is a right and every Nigerian should have access to affordable quality healthcare. Since our inception in 2007, we have provided informed commentary and in-depth analysis of health issues aimed at advocating for better healthcare for Nigerians. We have worked to actively engage and support the government in raising awareness and increasing knowledge on a wide range of health issues in Nigeria. Our unique capacity lies in our communication expertise, using a wide range of tools, including print, broadcast, and social media to enable our advocacy efforts. We have used our convening power to organize health policy dialogues, events, and webinars, bringing together policymakers and health experts to prefer solutions to the many health challenges in the country. Our evidence-based communication and advocacy has focused on health issues ranging from maternal newborn and child health, routine immunization, epidemic preparedness and response, universal health coverage, nutrition, and primary health care. We have worked with the following government ministries, development partners, and non-governmental organizations. We remain focused on meeting the health information gaps and needs of health professionals and the population in Nigeria. We are Nigeria Health Watch.
Thank you for clapping for us. So without further ado, I would like to invite the MD of Nigeria Health Watch, Vivian Iiazu, to give her opening remarks.
To have all of you gathered here today, our participants, our speakers, those online, thank you so much for joining us. Thank you so much to our online audience. And it's really, really great to be here this morning as we convene this 9th edition of our Future of Health conference. We're really excited to be here today, and you all being here this morning with us is a testament of your commitment for the collective good for Nigeria in advancing our healthcare. We all know that we face so many challenges in health. All of you here are critical stage. We all know, and the situation has accelerated, I'd say more so now, where we see the departure of our health workers to other countries. However, there is, and there still is a counter movement, and we have examples here with Dr. Ben from Regents Healthcare, talking about how can we leverage the collective power of our diaspora to improve the health sector. And during that conference, there were discussions on how can we have government policies that make this easier for people who want to reinvest, because Nigerians who leave don't instinctively want to go elsewhere. We understand the push and pull factors that lead to them leaving. But when they do want to return, what is in place for them? There are organizations like the Healthcare Federation of Nigeria that does a lot of work in this area. How can we collectively bargain and speak to those policies that can make that process a lot easier for Nigerians? In 2019, we looked at, again, innovations in healthcare. We see innovations in other sectors. How can we bring those innovations into healthcare? Then 2020, COVID hit, and we all had to go online. But that didn't stop us from doing the Future of Health conference. And then we used our platform to convene conversations around quality healthcare for Nigerians. We know that people may have access to healthcare, but if it's not quality, looking at those different dimensions from, is it efficient, is it timely, is it patient-centered? How can we bring in quality as a critical component in how we deliver healthcare? And then in 2021, we decided to look at an issue that really resonated during COVID. The majority of the health workers are female, are women. 70% of frontline health workers were women. But disproportionately, we were affected by COVID. And when we look at leadership positions, often we don't see enough women there. So how can we advocate for more women in those leadership positions? but also women sitting at the table, making decisions about our healthcare, when we know, or women know, what they need. But if we are not sitting at that table, then decisions that are made are not always in our best interest. So gender equality was a key issue we focused on during our 2021 conference, and elevated that discussion in the different areas which we don't often think about. We look at women in media. How can we have more women in media who can also make sure that when we talk about issues around healthcare, the media is there? Looking at technology, do we have enough women in that space? So that was one of the key issues we focused on in 2021, and that conversation up to now continues to be an issue that is very important. Of course, we're very happy that in this current government we have women in the healthcare sector who are in those positions, and we hope, for instance, Dr. Salma being the special advisor on health, and also the permanent secretary, also female. But we need more women at that leadership positions, because we already have many great women leading some of these healthcare institutions. Many of them are, in our room with us today. And then last year, preparation for the elections this year, we looked at the political economy of health. Health doesn't often get the priority, the political will we need. That's focused attention. So how can we push health up the political agenda as a critical issue that we discuss? And this year, for the first time, we've brought the Future of Health Conference to Lagos. I think our team has learned a lot about how do we network and engage with different stakeholders in such a large city like Lagos. But given the theme of the conference this year, the private sector as a catalyst for our health system, how can we build a resilient health system if we don't have the private sector working in partnership with the public sector, with government, how can we build a resilient health system? I think, we always go on about how many lessons we learned from the COVID-19 outbreak, where, through collective effort of the private sector, like through COVID, through that financing, through leveraging their efficiencies, logistics, we see how the private sector can play a critical role. There are many other areas we can see the private sector playing a very important role, and many of them you hear about today. When we think about supply chain, we look at the movement of health workers out of Nigeria. Private sector can play a very important role in areas of training and education. So there are multiple areas that we can see the private sector playing an important role. And we know that our health outcomes are not getting any better. And I think collectively all of us in this room know that we want to do better. We've been doing the same thing for many years, and things are not getting better. And we see a very, very vibrant, innovative private sector who can bring in the financing, the thinking, the innovation to really catalyze and build a more resilient health system for Nigerians. There is no reason why, something we always talk about Nigeria Health Watch and other organizations, why Nigeria has to be that country where women die giving birth, something that we take so for granted. We have immunization rates that are not what they should be, nutrition, so there's multiple issues that we all collectively care about and are all important to us. Through the three panel sessions, we will focus on these different areas. So looking at private sector financing, for health system strengthening, and also the private sector to sustain the brain gain. And thirdly, how can we ensure that we can leverage the private sector for better quality maternal health care? And we're always so fortunate this year to have a fireside chat organized by CEPI, looking at how can we bring the private sector to support research. And the focus is very much on Lassa fever vaccines. It's been over 50 years. We still have not found a viable Lassa fever vaccine. So those discussions will focus on that. But broader, how can the private sector support research into all these different areas that we are all focusing on? So that fireside chat will focus specifically on leveraging the private sector for research, looking at the scientific approach. So I hope you're all engaged. You've had the opportunity to network, speak to people you may not have met before. I think looking back at all the previous Future of Health conferences we've held, one thing that we always hear from people are the networks and the opportunity to meet people from different sectors. And that's why we bring people together in a forum such as this. Our team, of course, are on hand to have also to engage with all of you. But we invite all of you to engage with one another. I think collectively we are all after the same thing, a better health system for Nigerians. So really, again, really grateful to have all of you here this morning, standing on protocols that we started from the beginning. So you will meet all our different speakers, and you have details of who they are in the brochure, so do forgive us if we don't list out every single person in the room. We always say that every one of you is as important as the other. And if you want to get to know one another, then you have an opportunity to network and exchange cards or otherwise. So without further ado, I'll hand over back to the moderators, but thank you once again to all the partners that supported us in putting this together, to all the participants who came, the speakers, and of course our online audience, who we hope will stay with us throughout the day. So without further ado, I think I'll hand over to the compass to take you through to the next section. Thank you so much.
Thank you so much, Vivian, for the warm welcome. And I'll start off this next section from where you stopped. Our partners. Convening an event of this magnitude is not possible if you want to do it alone. It's only possible when you work with others. And we are here talking about private sector, collaboration, partnerships. So we are walking the talk as well. So we are really excited to introduce some of our partners to you who made this event possible today. Not all, you can see they are all listed here, but we'll just play a video that shows you who some of them are. Yes, thank you. I see.
It's Ibrahim, I'm the country director for MSI Nigeria Reproductive Choices. We are a leading provider of sexual and reproductive health products and services across Nigeria, supporting 30% of family planning service users in Nigeria. We are present in all the 36 states and the Federal Capital Territory, where we work with governments, donors, and civil society organizations to reach Nigerians, including the underserved and hard-to-reach women and girls in the communities with their reproductive health needs. Our interventions strengthen the health system and facilitate community collaboration and ownership of health interventions. Our operational approaches are designed to ensure reach, access, and inclusion. So join us to create a world where every birth is wanted.
Many African health markets find themselves trapped in this vicious cycle, a disconnect between demand, supply, and investments. Farm Access works with public and private partners to bridge this gap. We increase access to care through health insurance and new digital forms of health financing delivered through mobile health contracts. We help healthcare providers get access to capital so that they can invest in improving quality of service. And we developed the International Safe Care Standards, which stimulate quality improvement, enable benchmarking, and lower risks. research has demonstrated that this approach works, helping to increase access, improve quality, and build trust. Today, the world is on the brink of a digital revolution. Almost everyone in Africa has access to a mobile phone. To capitalize on this opportunity, we've initiated a digital platform that connects all players in the healthcare market, bringing transparency, efficiency, and direct access to and for end users. This technology generates a wealth of data that can help improve quality of care in unprecedented ways. And donors, governments, insurance companies, and even individuals can reach vulnerable groups or family members directly or contribute to digital funding pools, knowing for sure that their money will only be spent on health.
For the past 13 years, Solina Center for International Development and CIDA has undertaken a series of strategic initiatives aimed at enhancing and perpetuating the development of human capital outcomes for marginalized populations throughout the African continent. Our extensive portfolio comprises more than 40 projects spanning a spectrum of services, including strategic advisory, capacity building, health system diagnostics, consultancy, program design and implementation. Through the meticulous testing and deployment of customized innovations, our efforts have yielded remarkable results, notably in expanding access to immunization and maternal health services for both mothers and their children.
So we find that a big reason why mothers in Nigeria, while giving birth, is because even when they get to the health facility, there is not the right equipment, there's not the right commodities, capable hands in the facility to be able to take care of the woman.
We played a pivotal role in the successful polio eradication campaign in Nigeria and ensured the consistent delivery of antiretroviral medicines to a population exceeding 14,000 individuals living with HIV.
There's also the special intervention, which is supporting the states to vaccinate children in security compromised areas. And this we are currently supporting 7 states in the north, in ensuring that children are reached.
We have bolstered the resilience and capacity of both public and private sector ecosystems.
We are working with funding from MSD for mothers to reduce postpartum hemorrhage in 3 states: Kano, Lagos, and Niger.
CIDA, through its services, is optimizing health outcomes globally by improving the effectiveness and sustaining the ability of health systems through innovation and bridging knowledge action gaps. For more, please visit our website at www.cida.org.
The Policy Innovation Center is the first nationalized behavioral initiative in Africa, and our goal is to deliver better policies and innovative solutions for social impact. At the core of our work is using gender transformative and behavioral approaches to address critical development priorities and work towards the achievement of the Sustainable Development Goals, ensuring that we bring social impact strategies across a wide range of sectors.
Can we put our hands together for all the partners that made the conference possible? Thank you all so much for your contributions. Please remember to use the hashtag PS4HealthNG if you're tweeting about the conference. Anything interesting you want the world to know, please write it out and share with the hashtag PS4HealthNG. Also, we're taking your contributions online for those who are joining us online, and we'll share the link with you subsequently. We'll go on now to take the opening address today, and I'd love to welcome, joining us online, Dr. Salma Ibrahim. She is the Special Advisor to the President on Health of the Federal Republic of Nigeria. Please put your hands together for Dr. Salma Anas.
All right, thank you very much for that. Can you hear me all? You can hear?
Yes, we can hear you, ma'am.
Thank you very much. So let me start without repeating the protocol, but just to highlight some key ones. Dr. Vivian, the key convener of this very important conference, and your team, the panelists that are there today, distinguished participants. I've also seen a member of the Presidential Advisory Committee, Dr. Jide Idris, and all participants that attended physically and also virtually. A very good morning to you all. It is indeed a great honor to me to deliver the keynote address at this year's Future of Health Conference, being the ninth year in the series. The theme of the conference, the private sector as a catalyst for a resilient health system, to highlight the importance of leveraging the private sector's resources and capacities to further strengthen the efforts of the public sector, is apt and is coming at an auspicious time in the history of our country, Nigeria, with the renewed hope agenda of the administration of President Bola Ahmed Tinubu that is focused on harnessing the inherent potentials in the country to promote sustainable positive growth and development. I sincerely apologize that I'm not able to be with you in person at this very important conference in Lagos due to very important national assignment that I have today. And as you can hear my voice also, I'm just recovering from a severe upper respiratory tract infection. So please accept me to be part of this conference virtually. Indeed, the conference will surely add to the discourse to amplify the innovations that will lead to transformative change in the health sector through partnerships and collaborations. The theme and sub-themes of this conference are structured in a way to provide active participation of stakeholders in meaningful discussions that will contribute in the support for continuous engagements and deliberations of the health sector structure and performance. This is needed at this time to have viable engaging platforms for interactions on how to promote conversations of fruitful partnerships and collaborations that synergizes the efforts of the public and private sector, working together for a desirable health system that is capable of addressing the needs of the citizens, which improve health outcomes and overall well-being. We all know and recognize that the federal government, be at the subnational or local government level, cannot do it by itself. We need greater participation and support and stronger partnership with the private sector. Distinguished ladies and gentlemen, during the welcome address by Vivian, she has mentioned some of the scenario, the situation of the health sector in Nigeria, also indicating the burden of maternal mortality, as well as the poor children survival, including newborn in Nigeria. I'm not going to repeat that. We are so much aware of it. But it is a fact that we need a healthy population that is productive to be able to unlock the potential for positive growth and development, which will then lead to our collective and national prosperity. The health of Nigerians is fundamental human right and a matter of national security that requires a resilient health system to ensure provision and maintenance. The government is greatly investing in the health sector, but there has to be an active involvement of the private sectors to secure coverage and sustainability for sensible national growth, development, and progressive prosperity. In addition to what Vivian mentioned, we must recognize that Nigeria is currently bedeviled. There is no part of Nigeria that is not severely affected by one form of insecurity or the other, whether it is man-made or human, or man-made or natural disasters as a result of flood across the country, from the northeast with the terrorists, across the northwest, the kidnappings, the southeast, a lot of insecurity, kidnappings, and all some forms of insecurity, which is of great concern and also adds burden to the health sector. We must also recognize a significant portion of Nigerians that are confronted and directly have impact on them or indirectly on their health. This poses additional burden in the delivery of the health care, most especially delivery of quality health care to the citizens of Nigeria that we all desire. Therefore, the attainment of health-related SDGs, the Sustainable Development Goals of health for all, based on the universal healthcare coverage, using the continuum of care model where no one is left behind, is not possible without prioritizing and positioning the health sector to be more resilient and be more responsive to the needs of the people. Building a resilient health system requires confidence, trust, and it's a collective responsibility where no one can do it alone, but requires partnership and leveraging all potentials within the private sector. So I truly congratulate Health Watch for organizing this conference and making it the center of discussion as part of efforts to move the health sector forward in Nigeria. For the Nigerian health sector to get back towards achieving UHC after the post-COVID pandemic, which exposes the weaknesses of the health systems and the fragility of the health system, there was urgent need for a drastic and significant reforms. With what we have, we all know that it is not possible for us to achieve delivery of quality health care to the citizens of Nigeria without a reform. And we will all recall the previous administration initiated a health sector reform under the leadership of the Vice President as of that time. And the document was prepared and shared with all of us. Following that, the current administration, under the leadership of President Bola Ahmed Tinubu, set up the Presidential Advisory Committee. And within that committee also is a health sector committee, which I chaired. And I'm glad that one of our members will make a significant contribution to the discussion. Dr. Jide Idris is there with you physically, and that committee comprises experts drawn from the legislature, the private sector, the diaspora, and civil society organizations. And it looked at policies, including work done by the Health Sector Review Committee, Reform Committee, and had a lot of engagement with several stakeholders, development partners, government agencies, and also media organizations and several other stakeholders, and came up with a resolution based on the campaign promises and aligning with the campaign promises of President Bola Ahmed Tinubu before the election. So based on that, the outcome of that policy document, key thematic areas were identified, around 8 areas were identified, which was reviewed and also endorsed by President Bola Ahmed Tinubu as the only way we can move forward in fixing our health system for better performance and delivery. And I'm glad that this workshop, this conference, is also addressing most of those issues, one of which is around health governance, leadership, and institutional reform. We need to address those issues and also enhance and ensure effective overall coordination. And I'm glad that we have a minister today that is also tagged as a coordinating minister for health to show the importance of effective coordination of the health sector response, which will harness the limited resources that we have for maximum outcome. Another key area, as Vivian also mentioned, aligns with the 8th thematic area, which is health financing, very critical. But in as much as we talk about health financing, we also have to focus on absorptive capacity to be able to absorb resources on a timely manner. And we must also ensure effective transparency and accountability of resources deployed within the health sector, whether within government or outside government. So there is need to deepen political commitment on health through increased and sustainable financing from government. Government is committed to demonstrate stronger commitment to health financing and also explore other opportunities and sources of financing. Of course, institutionalizing accountability mechanisms within the systems. The third aspect that we really discussed extensively with partners and several stakeholders under the Presidential Advisory Committee is related to the quality of care. Because we noticed and observed what came out clearly was silos and duplication of efforts. And then there is no connectivity or poor referral systems within our healthcare delivery, from the primary healthcare level, the secondary level of care, and also the tertiary level of care. And this is across board, both public and private sector. So there is need to restructure and redesign the service delivery outlets that position and strengthen the primary healthcare as a bedrock of the healthcare system, with about 80% of government investment in the health sector. We need to strengthen our referral systems across the 3 levels of care, primary, secondary, and tertiary, and provide standards and regulations through training, routine supportive supervision, and monitoring. The tertiary facilities will actively support the lower levels of care with to access expertise and improve outcomes and ensure standards and quality to everyone. The area of private sector, all private sectors needs to play a role to build a resilient health system. But for emphasis, the private sector have a major role to play in the 4th aspects of the thematic areas that has to do with local manufacture of commodities, medical commodities, drugs, and all consumables and supplies, but also, most importantly, local production of vaccines in Nigeria. Once upon a time, you will all recall, most of you that are here in this room, that Nigeria used to produce vaccines, yellow fever vaccines, even smallpox vaccine in the past. What has happened after several years? So we need to regain the glory and bring back better production of vaccines in Nigeria, and also reverse also local manufacturing, so that Nigerians will be able to reverse at least to a level of up to 60% of local manufacturing to be happening in Nigeria, including APIs. Another area that is of importance, which we have just experienced and learned a lot of lessons from the COVID pandemic, is our health systems. It's our public health emergencies response and preparedness. We need to do more in terms of strengthening and ensure that we attain health security through an effective and efficient public health emergency and public response. I'm glad to mention that we've made some progress. From the recent reports that we have received, Nigeria has made some modest progress towards achieving that. We need to sustain and also put in more efforts at the sub-national levels in collaboration across all entities with our relevant partners. Human resources for health is a big issue. It's a huge gap, which has always been a challenge in Nigeria, even before the COVID pandemic. It has become worse currently with the economic situation, whereby majorities of our skilled health workers are leaving the country. They are migrating to more developed countries due to several factors. So we are working very hard and assiduously to put in efforts on how best we can increase competency and ensure equitable distribution of motivated and supported health workforce, as well as put in mechanisms for increased production, not only within the public training institutions, but also increased production within the private sector institutions. So we encourage private sectors to join hands with government in setting up training institutions, especially institutions of School of Nursing and Midwifery, and as well as other health professionals in the country. But also we must put in mechanisms, which we are trying to do, of retaining our health workers within the country, as well as also attracting those that are in diaspora to make contributions to the country. Not the last, but number 7 of that item, which we really deliberated so much on, is on information. Without information, without use of evidence, we cannot have the right policies in the right places. We cannot monitor progress and track the work that we are doing. So focus will be made on information management, use and deployment of new technologies, as well as research. I'm glad this conference has also talked about support for research by the private sector. So we invite private sectors to invest in the research and use of suitable technology to improve our health systems. Last but not the least is what we're here witnessing today about partnership. Without partnership, the health sector cannot grow and it cannot deliver quality health services. We cannot achieve universal healthcare coverage. As I have said, even though government is going to invest heavily, especially in the primary healthcare facilities, but we recognize the roles of public and private sectors, the non-governmental organizations, in strengthening the health systems. And we need to leverage those trends and opportunities to foster relationship between the public and private sectors. And we are very glad, and I congratulate Health Watch for really making a lot of efforts and sustaining efforts they have started several years ago in leveraging opportunities within private sectors and which will virtually strengthen our health systems. Distinguished ladies and gentlemen, I don't want to speak so much, but I must mention that under the administration of President Bola Ahmed Tinubu, which has prioritized engagement of stakeholders, especially the private sector, to achieve the desired goals for health growth and development, with over 70% of private expenditure on health as a share of the total health spending in the country. Having strategic and meaningful partnerships and collaboration between public and private sector is key towards unlocking the huge potentials and improvement of the overall health sector in the country. By leveraging on the existing opportunities and possibilities of public-private partnerships, Nigeria can make substantial progress towards achieving UHC within a very short time. Advancing healthcare delivery, improving access and ensuring financial protection, and having, most importantly, a resilient health system for all Nigerians. But as I said earlier, this requires crucial reforms that establish clear rules and responsibilities with robust governance framework, transparent and accountability mechanisms to ensure the interests of both public and private sectors are well safeguarded. Distinguished participants and organizers and partners, we all know that achieving a resilient health system requires multi-sectoral and multifaceted approach, where both public and private sector collaborates and synergize to accelerate progress towards this goal. With this, Nigeria can have the right policy space, enhance health infrastructure, requisite manpower, deploy appropriate technologies, guarantee pharmaceutical supplies with supportive logistics, improve service delivery, mobilize additional resources. There are several untapped resources, and also enhance utilization of the available resources, whereby we can promote equitable access to quality healthcare to all citizens. And this is in line with the renewed hope mantra of this administration of inclusivity and partnership, especially between the public and private sector for developmental groups that leads to national prosperity. Before I end, I must once more congratulate Nigeria Health Watch again and again for organizing this annual conference on future of health in Nigeria. Indeed, how do we want our future to look like? This is a very critical time to dialogue, and also for organizing series of dialogue within a very short period of time, and providing veritable platforms for deliberating on health issues that contribute to improvement of the health system. Most importantly, I'm very happy with the New Health Watch for pushing the agenda of the health of women and children. It is sad anytime we sit around the table and watch and also see the trend of maternal death, women dying as a result of pregnancy and childbirth, poor survival of our children, poor coverage of immunization. So I'm glad that this is also coming back, and we must prioritize maternal, newborn, and child health. With our joint efforts, I strongly believe that we can change the narrative. I once again apologize for not being there with you physically in Lagos for this wonderful gathering of experts and participants. And I wish all of us a fruitful deliberations with resolutions that will positively add to the building of a resilient health system for Nigeria that we'll be all proud of, and have zero tolerance for death of women related to pregnancies and childbirth. Thank you very much, and God bless all of us.
Thank you so much, Dr. Anas, for that opening address and for highlighting so many important things that we'll be discussing here today. And also, they've been the issues really that has been informing the work we do at Nigeria Health Watch. The need for evidence-based advocacy, information, transparency, accountability. But again, also the need to work with the public sector. While we recognize the need for the potentials that are inherent in the private sector, we also understand that it's important for those two different worlds to come together. So thank you so much for that. But again, taking that conversation forward, who is best suited to also take it further on the role of the public sector, how they can advance that conversation, how they can work together with private sector, than the Honorable Minister himself. So it's with great pleasure that I invite Professor Mohammed Ali Pate, the Coordinating Minister for Health and Social Welfare, for his keynote address. He would have loved to be with us here in person, but he is not able to. So he will be he sent us his keynote address that we're going to play right now. Thank you very much.
Good morning, participants. I sincerely wanted to be with you in person, but unfortunately I have been unable to adjust my schedule to participate into this important conference with you. But it's a very important moment for Nigeria's health as the country is undergoing several transitions, and health is a core component within that transition. We're undergoing an epidemiological transition. We're seeing shifts in burden of disease towards non-communicable diseases that are fast-growing. We are having a demographic transition, even though it's slow, with a very fast-growing but youthful population that has a lot of promise in terms of productivity and economic development over time. We're also seeing aging, which is adding to the non-communicable disease burden, and an economic transition with our economy diversifying, and we expect that to continue. Within that, health is a core aspect for preserving, accumulating the human capital that is necessary for our growth growth and prosperity into the future. Health investments are important as driver of that growth and prosperity, but also can be a consequence of that growth and prosperity. And at the moment, there's a gap between where our health outcomes are as a people and where we should be or we could be, given the tremendous resources that we have in human and material resources as a country. President Bola Ahmed Tinubu mandated us in the context of his renewal agenda for Nigeria to drive a transformation in Nigeria's health sector. We articulated a 4-point agenda focused on improving the overall governance of health, bringing stakeholders in the mixed health system that we have, public and private actors, civil society, are listening to our citizens, are responding to their needs, being accountable to them, and using data to guide our decisions, and improving the overall regulatory framework in health, not only for commodities, but for services for health professionals as part of an effort to improve governance of health. Working across federal, state, and local governments, and working with private sector actors, as well as our international development partners in this effort. The second aspect is to do the things that are going to improve population health outcomes. The basic things, whether it's delivery of essential services like immunization, delivery of maternal and child health services or reproductive health, commodities for women through public and private channels, dealing with non-communicable diseases in our primary healthcare system or secondary facilities and tertiary facilities. That requires human resources who can be trained by the public sector or the private sector. That requires additional financing, not only from governmental resources, but also private capital that can play an important role. That requires a strong third-party payer. The NHIA reforms and expansion of insurance coverage, I think, would go a long way in improving the affordability of healthcare, protecting our population from catastrophic health expenditures, but also enable private sector partners to count on a predictable source of financing and make investments so that they can contribute in this journey that we are undertaking. The third plank is to unlock the value chain of health. There's a value chain in the health sector, from pre-service training to the service delivery itself, with the private sector can play an important role, to the manufacturing of basic things, from where we are now 70 to 80% of our generics and pharmaceuticals on some counts are imported. With a population of more than 200 million, we've got the market that we can begin to domesticate the production of some of those consumables and basic pharmaceuticals and even medical devices. High-end things like the biologicals are going to be important because of the burden of non-communicable diseases, as well as things like vaccines, as we saw during COVID. So that's an important agenda that we will pursue, and we'll do that in a cross-ministerial way, adopting a whole-of-government approach. So that it's not just the Ministry of Health, but Ministry of Trade, Ministry of Finance, the key regulators, the private sector partners, as partners to government, including entities that have been working on this for some time, but to accelerate it given the policy priority that this government has placed on this agenda. And finally, to deal with health security as a matter of economic security and global security. It's also key to our national security, as we saw with the pandemic. Private sector actors know that when outbreaks occur, they also get shafted by them. When Ebola hit West Africa in 2014, private sector actors suffered from it. When restaurants can't open, when businesses are locked down, like we saw during COVID, when the supplies can't move because of a pandemic. And that affects the economy, but it also directly affects farms. And so farms have a vested interest to look at the health security as an important aspect and to be prepared for eventualities. Within those 4 pillars, with the mandate of the President, we are now beginning to organize and to execute on them so that over time we can track progress and show results. We will do that with an approach that is acknowledging the mixed nature of our health system that sees complementary value propositions from different sectors. the private sector not only can it contribute the financial resources beyond what the state itself can do or has to do, but there are also ideas, there are ways of operating, there are innovations, there are partnerships that can be constructed between public sector and private sector to leverage each other's capabilities, to invest in infrastructure, to invest in manufacturing, to invest in logistics and supply chain approaches that would deliver to the last mile, to invest in training, to extend the production of a health workforce that can drive further the economic development imperative, and health as a key part of that. So those are all elements that we hope to bring in to transform Nigeria's health sector into the future. So this is a very timely conversation, and I thank the organizers for inviting me to make these remarks. Thank you.
Special thanks to the Honorable Minister for that keynote address. And really, there are so many things to unpack from that presentation and the Dr. Salma's earlier presentation. And for us, like they say in some Nigerian movies, this is just the beginning, because these conversations don't end here. It's actually a thing that we pride ourselves in. We take these conversations outside the room. So across our social media platforms in the coming days, months, and even years, if you go back to our platforms, you see conversations that happened as far back as 9 years ago, like Vivian said, when we had the first Future of Health conference. So those will be there. We curate them and send them out and continue the advocacy, because for us, the advocacy for private sector to invest in a resilient health system shouldn't end here and won't end here. So please do continue the engagement, share your thoughts, use the hashtag PS4HealthNG. The next presentation is from the Lagos State Ministry of Health, the Honorable Commissioner for Health, represented by the Permanent Secretary, Dr. Olusegun Oboye. He will be coming up to make an opening presentation on behalf of the Permanent Secretary. Dr. Oboye, please. So on behalf of the Commissioner for Health. Can you put up his slides?
Which way is forward? Okay. While we're trying to sort this out, I just wanted to say that those of you that are very observant might have noticed that I am not Professor Akin Abayami, even though our complexion is extremely similar, but I think I'm just slightly shorter than he is. But yeah, you try it, see if it works. Just to acknowledge the convener, MD of Health Watch, Vivian Iiazu, my boss, the former Commissioner for Health, Lagos State, Dr. Idris, esteemed speakers at this conference, distinguished ladies and gentlemen. I'm here to present the presentation that was assigned to the Honorable Commissioner, who's currently away in Dakar and is unable to be here with us today. He sends his greetings, and I'm sure he'll probably catch us on one of the other days. It's about the private sector as a catalyst for a resilient health system. And it starts really about the relationship between government and the private sector. I know that over time, that is a relationship where a lot of trust has probably eroded, and it's something that we're trying to build back in Lagos State to ensure that it's a partnership where both parties are fully respectful of each other and engage closely with each other. The government, as we all know, no matter how much they want to increase funding for health, is unable to provide all that is required, especially because they are also dealing with a lot of other sectors and economies are contracting all over the world. So the infrastructure gap that exists in health cannot be funded by government alone. It requires the participation and support of the health sector. Government needs to optimize resources by building reference centers of excellence while leveraging on the capacity of the private sector to meet the healthcare supply needs. We also need to be extremely creative in boosting health-related economy by leveraging the private sector. I think one key thing that we all need to look at is government sees health purely as a social service, or the people look on government to provide health purely as a social service. But the private sector sees health as a source of a potential to develop the economy of the country and a place where, a business where a lot of money can be unlocked. So the role of government of the public sector in the partnership is mainly around policy, initiating policies to guide what goes on in the sector and then to regulate the activities of the private sector. The private sector brings to the partnership its own comparative advantage, which is the capacity that they have, the funding that they have, and a lot of the technical skills that exist in the private sector that we do not have in the public sector. So while the public sector initiates and monitors the activities that go on in the health sector, the private sector drives and supports healthcare. In the traditional relationship, what tends to happen is private sector contributes some money to health on behalf of government or to support government, and then government decides, you know what, for giving us this amount, we will give you this kind of tax break, or we will give you land for free somewhere. You know, it's just a trade-off like that. But what we're looking at now is a more inclusive partnership where we see each other as partners in progress, and each of us brings our own comparative advantage to this relationship, so that we are both leveraging on our individual advantages in that relationship. So roles and responsibilities of the public and private sectors. There's been a lot of talk about the earlier speakers spoke about the possibilities that exist for research and development within the private sector. And this is something that would be extremely useful to us in the public sector. The public sector, like I said earlier, makes policies, regulates, and then we are the public defenders. We ensure that the poor, the vulnerable are also carried along and are not left behind in our health programs. And then it's also our role to ensure that the private sector players that want to participate in the health sector are able to do so. So we are supposed to facilitate the ease of doing business. Private sector brings investment, brings skills, entrepreneurship, and they are mainly in control of all the major factors of production. Then we have the philanthropic organizations that provide for us funding and technical assistance. So this looks at the Lagos State approach to leveraging private sector funding and capacity. So we have this innovative central planning which revolves around the public sector, and then we leverage private sector capacity and private sector funding to achieve a fit-for-purpose healthcare infrastructure. A lot of the healthcare infrastructure was based on conversions from one use to another, and some of them are not quite fit for purpose, and we've been trying to work to move towards getting them building new ones that are purely fit for purpose, and then retrofitting some of our old ones to meet the purposes for which we are using them. It's also about getting modernized medical equipment for our healthcare facilities, and that is something we're also strengthening to do with the private sector through something we call the Medical Diagnostics and Services Provision Scheme, which we're hoping that we can get a lot of private sector partners to come in and provide equipment, to run lab services and other diagnostic services in partnership with our own health facilities. It's also about effective pandemic preparedness through infectious disease research, and we're also currently working on building an infectious disease research institute that's supposed to be a center of excellence for research in infectious diseases. Then we also want to develop world-class tertiary and quaternary care centers in partnership with the private sector. Want to improve health financing systems. The climate for that is definitely improving, as also we've heard from the previous speakers, with the mandatory health insurance that now exists, and there's a need for a strong handshake between the government health insurance system and the private health insurance systems to ensure that, there's a lot of risk pooling, and there's some harmonization between benefit packages for the beneficiaries. Also ensuring equity in service provision to ensure that no one is left behind. There's been a talk also earlier by the earlier speakers about the improved retention of human resources for health. We are all aware that the push factors are really strong. The pull factors are really strong, and whatever we do to reduce or minimize the push factors may just not be enough. So there's talk now and thinking around increasing production of our health workforce, and the private sector can definitely play a part in that, in the establishment of training institutions, medical schools, but also even for doctors that have graduated, working with the private sector to improve their skills and training, especially because a lot of the private sector hospitals, for instance, have more advanced equipment. Then there's also evidence-based medicine and data-driven health system, improving our data collection, data processing, to ensure that we use data to drive information and to drive improvements in the health system. Then one thing that we're not showing there is improving digitalization, increasing digitalization of the health sector. And those of you who are, who've been with the public health, with the public system for a while will also know that we're planning now to set up something called the SHIP, the State Health Information Platform, which is a health information exchange, and that is supposed to strengthen digital health in Lagos, and it's of course going to be driven largely by the private sector. So this is one of our PPP initiatives. Is the Omotunde Ajoke Cole Hospital. It's inside General Hospital, Lagos, the one on Broad Street, and was built by the state, but it's been ceded out to the private sector completely for its management. And also we have smaller partnerships in all our hospitals for lab partnerships, pharmacy partnerships, and different partnerships where private sector organizations run these services in our hospitals, as long as it doesn't collide with what the hospitals themselves are able to provide. So where a hospital is able to provide lower level services, then we leverage on the private sector to provide the more advanced services even in that setting. So lessons learned from including the private sector in the Lagos State health system. One, central planning. Public emergencies should solely be in the control of a public sector via a central planning approach. And I'm going to just refer us back to the COVID thing where we had the central planning for it through the EOC, the Emergency Operations Center, that had private sector support, private for profit, private not for profit, as well as the public sector, all sitting together to plan the response. And the response, the support from the private sector was excellent. Technical support into the EOC, as well as just donations in terms of PPP, ventilators at the time, all the things that were needed. So it was clear that working together, we could achieve quite a lot. Secondly, private sector inclusion is necessary, and it should happen at an early stage, because that's when the private sector can give us the benefit of their own skills in the planning before things go too far down. Then there's a need for firm regulation. The private sector is in business to make money, but the state has a responsibility to ensure that people are taken care of and health indices improve in Lagos, whether they have money or not. So that's part of our regulatory function, to ensure that things don't run away and people get left behind simply because they're unable to afford health care. Then also that communication must be clear. There is a bit of a difference in the way public sector speaks and in the way private sector speaks. And I think things sometimes get lost in translation. So it's important to ensure that this the communication is clear between them. We have a challenge of bureaucracy, and the private sector has a challenge of maybe not looking too carefully at things. So we need to work on that and arrange and get a better midline. Policy factors to facilitate inclusion of the private sector, financial commitment to health. No matter how broke the government is, it must still commit resources to healthcare. And no matter how much it commits, there's still going to be a need for more. So we will need to be working with the private sector to do that. Health coverage and financing mandate, health insurance, strategic purchasing, policies should be put in place to define how demand for healthcare will be financed. Like I said, this is much better now with the health insurance that is coming on stream as being mandatory. And I also wanted to mention the issue around access to finance for strengthening primary health care. We have a lot of primary health care centers that are currently falling into dilapidation, probably because of challenges with funding. And it's something that we're looking at, finding people to take on. If health insurance is working, capitation is available, and people are getting money, then it's easier for them to be able to pay back loans or whatever they use to develop these primary health care centers. So that's another opportunity that exists right now for working with the private sector. So commitment to equity and solidarity policies must be put in place to ensure that there exists an egalitarian system through solidarity and the availability of subsidies for social safety nets. We all know that Lagos now has what we call the Themes Plus, which focuses, the plus part of it focuses on these social safety nets. And it's important, and again, we're making sure that nobody gets left behind purely because of what they can or cannot afford or where they live. There needs to be a consolidation of risk pools. Health insurance only works when risk pools are consolidated. Otherwise, adverse selection creates challenges, especially for public financed health insurance schemes. We need to recognize limits to decentralization. While we decentralize and farm out some things to the private sector, we still need to be firmly in the driving seat to ensure that, like I said so many times, nobody gets left behind. Private financing, the private sector holds the key to unlocking the potential of a vibrant supply side. government must leverage private sector financing. Through my work in government, I've found out over time that dealing with finance and with people as government is very, very difficult. People always, especially when I was working in HIV and we were giving grants to people to help develop help them earn an income so they could take care of their relations or loved ones that had HIV. It turned out that every grant or every loan we gave out, none of them ever came back. And when we, looked at why, it was simple. Anything that is from government is considered national cake, and so nobody needs to return anything. And so financing is better when it's handled by the private sector, because they will make sure that their money comes back. So in conclusion, the most effective tool the government has is policy. The policy environment needs to be right. It needs to be in tune with what's happening at the time. We constantly in government have to do our own horizon scanning and ensure that our policies are in line with developments in healthcare. And the right policies will increase the ease of doing business for the private sector, and in return share in revenue generated in order to fund government activities and ensure sustainability. The government has no business doing business, but rather providing regulatory oversight and creating a template benchmark models for adoption by the private sector. Thank you very much.
Please, another round of applause for the look-alike of Professor Abayomi. It says they are look-alikes and they're close in complexion. Who else checked again? I had to look again because I wanted to be sure I was seeing properly. Thank you so much for that. He hit all the right points, and I'm sure they were noting all the points. Again, we thank you all for engaging online. We're seeing your tweets, your pictures, your posts, and we thank you for engaging. If you haven't done so, please use the hashtag PS4HealthNG. If you're on Twitter, hashtag PS, that's public sector 4, number 4, HealthNG. We're heading into our panel sessions, and here's where the juice is, because we want to hear your contributions, and we will tell you more about how you can contribute as a panel unfolds. Our first panel would look at private sector financing for health systems strengthening to achieve universal health coverage. Private sector financing for health systems strengthening to achieve universal health coverage. To moderate this panel, please help me welcome Dr. Kemisola Agboye, who's the Director of Programs for Nigeria Health Watch. A round of applause, please.
Good morning, everyone. Good morning. Thank you so much once again for being here with us. I will be moderating the panel on private sector financing for health system strengthening to achieve universal health coverage. We've already heard so much about the Nigerian health sector and where we're at. We know that out-of-pocket expenditure is at over 70%. We know that we have improving health indices. We also have had some important milestones recently. For example, the National Health Insurance Authority Act was signed last year, and the operational guidelines have been launched a couple of days ago. And we know how the private sector has stepped in the past with the response to the COVID-19 pandemic. We had key vehicles that came into play and that helped cushion the effects of the pandemic and helped strengthen our health systems. We also know that there are important and interesting public-private sector vehicles already operating, such as the Nigeria Sovereign Investment Authority Fund, which we would be hearing about later. And we know how important the role of third-party administrators and health maintenance organizations are in the operationalization of the National Health Insurance Authority Act. And we'll also be hearing on this panel from the subnational level. We have a former Commissioner for Health, the former Commissioner for Health for Lagos State, who will be sharing from his experience as the former commissioner, but also in roles that he's taking on after that. How the federal government, for example, is looking into integrating private sector to strengthen health systems. So this is a really interesting panel. I'm really honored to be moderating it. I have distinguished speakers who I'll be inviting up shortly. Please help me welcome Dr. Tinola Akinbolagbe, who is the Managing Director and Chief Executive Officer of the Private Sector Health Alliance of Nigeria. Dr. Tinola, please have your seat. Help me welcome Dr. Tolulope Adewale, who is the Managing Director of the Nigeria Sovereign Investment Authority, Advanced Medical Services Limited, MedServ. Please help me welcome him to the stage as well. Dr. Jadesola Idowu, who is Chief Operating Officer at AXA Mansard Health Limited. Please have your seats. Welcome her to the stage. And finally, Dr. Olajide Idris, who is the former Commissioner for Health of Lagos State. Please help me welcome him right here to the stage. Okay, this wasn't intentional, having having the women on one side and the men on one side wasn't intentional at all. But so, great. Okay, thank you so much. So the format for this is, it's slightly different from your typical panel. Each of these distinguished speakers will come up here and give you a really brief, interesting talk for, say, 5 to 7 minutes, after which we will then have a moderated panel, and you will have access, you'll be able to interact with the session live. On every table is a card that has a QR code. Please scan it, it will take you to Mentimeter, where you can interact live. You can leave comments and you can also leave questions. We will scroll through at the end of this panel to see what questions can be answered. I would also maybe take a couple of questions from the audience that's seated here. So first, to give her presentation, please help me welcome Dr. Tinola Akinbolagbe, who will be speaking to private sector financing for health system strength.
Thank you. Good morning, distinguished ladies and gentlemen. I'd like to stand on existing protocol, but of course acknowledge our convener, the MD of Nigeria Health Watch, Mrs. Vivian Iiazu, the former Commissioner of Health for Lagos, Professor Dr. Jide Idris, and of course the PermSec of Health, who I think has left, my same complexion brother who just went before me. So I'm going to speak a bit about the Private Sector Health Alliance of Nigeria. It's interesting, the topic or the theme for today's conference. I feel the weight of the entire multi-private sector on my shoulders, and I hope I can do them proud. So the Private Sector Health Alliance of Nigeria, our mission is to be the business-led platform that mobilizes resources and capabilities to improve Nigeria's healthcare system and complement what the government is doing, very important part of our mandate. We've addressed a lot of healthcare sector challenges with programs in public health strategy, health system strengthening, supply chain transformation, nutrition, health innovation, transformation, health leadership development, and mental health. So PSHAN, the Private Sector Health Alliance of Nigeria, was incorporated initially as a roundtable. This was in 2010, where we had industry leaders, Alhaji Aliko Dangote, Mr. Bill Gates, Mr. Igwe Imokwede, and Mr. Jimovia, amongst other private sector leaders, come together. They had realized that the healthcare sector in Nigeria was not moving as well as other sectors. As previous speakers have noted, telecoms in Nigeria, the finance sector, fintech, we've made a lot of strides in various sectors in Nigeria, but the health sector just couldn't seem to keep up to the same level. So over the course of the years, PSHAN has worked on several programs. A few of them are the Nigeria Healthcare Quality Initiative, the Alliance for Epidemic Preparedness, the ADFIN, which was for nutrition support, and also supply chain transformation with the ARC initiative, which was sponsored by the Bill and Melinda Gates Foundation and Gavi. In 2021, PSHAN decided to re-strategize and look at how we could impact health from a point of view that would affect the greater majority of Nigerians. We understand that for us to even think of achieving universal health coverage, we must address primary health care. And that is somewhere that even angels fear to tread. And that is why PSHAN went into that. I don't want to spend too much time on the challenges of the Nigeria healthcare system. I think a lot of us know that. But when we look at Nigeria and we have titles like, we have the largest number of zero-dose immunization children, those are not titles that you're proud to have. You know, maternal mortality, there are changes being done, but the needle isn't moving as quickly as we would want it to. So these are some of the issues that we wanted to address at the primary healthcare level. So how does PSHAN contribute to bridging some of the gaps we've identified in the healthcare system? We convene and mobilize the private sector. The private sector, as a few speakers mentioned before me, there has been a lot of trust erosion in their partnerships with the public sector. But PSHAN stands to bridge that gap and to build back that trust. If we have members of the private sector putting together small sums of money, financing, and other resources, on their own, that can't do a lot. But if we pull that all together, like we saw during COVID, we really can make a difference. COVID managed to raise 80 billion naira, entirely domestic funding. I think that's a landmark achievement. PSHAN also works to identify opportunities to enhance the value chain in the healthcare sector. And we're working to establish a nationwide understanding of what is really required to move the needle on healthcare. So some of the programs we've done in the past, Malaria to Zero initiative, this was done with Access Bank. ADFIN, which was to sponsor nutrition in the north central and northwestern parts of Nigeria with the Aliko Dangote Foundation. PSHAN also incorporated the Nigeria Health Innovation Marketplace, NHIM, and we continue to engage stakeholders, the government, civil society, and the media by building support for investments, which are some of the issues that we'll discuss today. There must be a business case for the private multi-sector, not just the private health sector, the private multi-sector to invest in health. For those of you who watch Netflix as much as I do, some of the newer movies that have been released recently have been financed by fintech. So you're having cross-sector collaboration. You're having the finance sector investing in Nollywood, in entertainment. So why can't we have other members of the private sector, the multi-private sector, invest in healthcare? We need to make a business case. We need to educate them to understand that in healthcare, generally, you can't have short-term investments. You have more the and long-term investments. We need to put processes in place such that when the government does change, it doesn't affect the PPP that you have. Because sometimes you have changes in government from one party to the other. A lot of those of us that are here that have had some type of experience with the healthcare system in the United Kingdom, my brother in front here is one of them, can confirm that a lot of care that you receive under the NHS is actually provided by private care providers. But you don't know that. From the outside, you just see the NHS. And that is a mixed system which we must develop in Nigeria. In Nigeria, roughly, we have 50% of the care being provided by the private healthcare providers, and roughly 50. Obviously, there are regional variations between the north and south. But if you average it out, it's 50-50. So we must work together. I recently just got back from a program organized by Farm Access Foundation in Amsterdam, and someone gave an example which I think really exemplifies what this is all about. He said when you have the public and you have the private, it's like a marriage that must happen. So you have two potential spouses. They must work together. That marriage must happen. Some marriages work, some don't. But the fruit of that marriage would be the children, the universal health care that is accessible to all Nigerians. So we're here today to find how to make this courtship work and to make sure that this marriage happens. It's a happy marriage, and it does drive the change that we want to see. Thank you.
Thank you. Thank you so much, Dr. Tino. That was really profound. And I like some of the examples you gave of how we can engage the multi-sector. You know, those of us in the health sector tend to continue to speak in echo chambers. We're constantly talking to ourselves. And it really is time to branch out. Thank you so much. So next, please welcome Dr. Jadisola Idowu, who would be speaking to us from Axamansad Health Limited.
Thank you. Good morning, everyone, and standing on existing protocols, but I must acknowledge the former Commissioner for Health in Lagos State, Dr. Jide Idris, my former MD, Mrs. Njide Ndili, and also Mrs. Fola Laoye. And incidentally, talking about universal health coverage, also remembering our late Professor Adele Bute, where we pioneered the first community-based health insurance program in Shonga, Kwara State in 2007. So now I'll be talking about healthcare in the private sector and how in Axamansad. So right now I am the Chief Operating Officer, Axamansad Health, and I'll be talking of how we've been able to bring healthcare even to the people not in the corporate world, the people in the informal sector that are not even covered by our corporate plans, the people that are really under the 70% of the population in the rural areas. And talking about private sector financing for health system, I hope it's off now, thank you. And the Axamansad example. Now, in order to achieve universal health coverage and make healthcare accessible to all, regardless of their pockets, regardless of their status or where they live, we must have healthcare innovation, which is what we pride ourselves in Axamansad. Incidentally, we just marked our 10 years anniversary just last week, Saturday, and it was a great time, remembering all the successes. But in the last 10 years, AXA has grown in innovation and technology, and that has actually propelled us into the top as the #1 HMO in Nigeria, delivering healthcare to the population, not just in the corporate world, but also in the informal sector. Now, healthcare innovation, this was said by an anonymous, is not just about latest technology, it's about creating solutions that empower and improve the lives of individuals, making quality healthcare accessible to all. That is the way out. Now, brain drain, I mean, another panelist will be talking about that. We don't have enough healthcare. Right now, the doctor-to-patient ratio in Nigeria is 1 to over 9,000. And every day, our doctors, our nurses, all the healthcare personnel are leaving the country. So how can we still have universal health coverage and give access to our teeming population of over 200 million people? We must be innovative. We must think out of the box and see how we can reach the unreached population in the rural areas. Now, AXA Mansard, through innovation, we have been part of creating this solution and creating a future for our people. And this innovation has brought in a lot of ideas, novelty, and technology drive that has brought access to healthcare for the informal sector, especially, that have largely been unreached. Now, the health indices of Nigeria are not fantastic, and I'm glad we have the powers that be, the Minister for Health, the special assistant to the government, and I'm sure the present government are doing something about it. Because even before now, when you talk about financing for healthcare, there was an Abuja declaration in 2001 where the AU came together and said all countries must have 15% of their healthcare, of their budget, allocated to health. And Nigeria has never met that target. In fact, the greatest we've met was in 2006, which was 5.8% of the budget. This last year's budget of 2023, or this year's budget before the new administration came in, that was passed by the former President Muhammadu Buhari, the budget was 5.75%, which is still far below the Abuja Declaration. It's only countries like Rwanda and South Africa that are missing this 15%. And when the budget is not there, when the political will is not there to fund it, yes, private sector will support, then we are still not getting it, because now you need to fund immunization. The essay to the government, president was talking about having us produce vaccines like Gavi in Nigeria, the way we were doing in the past. That will take funding, and the government needs to drive that. Having us, do a lot of things, reaching the unreached. A lot of our children, IDPs, they are back to Lagos. They are coming to Lagos by their drones. Many of them were having another surge of polio epidemic. Now we must fund healthcare, and until we begin to address funding of healthcare, the budget issues, 5.75 is not sufficient. That came to about 1.71 trillion. Now, of course, that's the highest we've had, but that was just really not enough. And we're talking of a budget of 20.5 trillion in all. Healthcare still had very low, below 2%. So we really need to do something about it. Now, healthcare indices of Nigeria, I needed to stress this so that we can all take it and not just beyond the presentation, be passionate about it and do your part to see that we have this universal health coverage, reach our populace in our own way, in your own little way, whether in the private sector, more especially in the public sector, to finance it and to also have the political will to drive it down to the bottom. Life expectancy in Nigeria right now is 53 years for men and about 55 for women. Infant mortality, maternal mortality are all there. We can see the table. I won't go over it. And of course, we live in peculiar times. I don't know who is not feeling the economy. The price of fuel has gone up, and most people are opting for self-care, and now going through the pharmacies, going to, hawkers, people that hawk products all over the streets, and of course, talk of traditional people. They are on TV, they are on air, selling herbal products that have not been licensed. So we have a lot of issues. Lack of disposable income is also making it difficult to people to afford even basic amenities. And when we talk of nutrition, your nutrition is so key to sound immune system. People are not feeding well. And of course, let's go to the issue with the Forex deregulation, which is affecting us even as an organization. Now the price of drugs and all our hospitals and providers are complaining because it's gone over 300%, because most of them are imported. Now, let me go to what AXA has done. Our purpose was to move from payer to partner, and we did that through 5 key areas, dealing with the people, the products, of course, innovative products, data, technology, and our distribution pathways. Our corporate plan is there. Our international plan is about focus on the micro-insurance and inclusion plans and the retail plan we have. Our retail plan, with only 12,000 Naira, you can access healthcare for 6 months with our Easy Care plan. Now, the microinsurance products are the most innovative, where even with 450 per head per month, you can access healthcare. And I'll end up with the malaria insurance products. We have other health products that are listed here. The malaria insurance, micro health, telemedicine drive is also one. And of course, right now we just launched a highbrow hospital in Ikeja with the One Health Medical Center that is facilitating that and also bringing a lot of expatriates on board. They are along Mobolaji Bank Anthony as a way to also drive and reduce the brain drain. Retail health and home-based care. Now, our malaria initiative, we know malaria, even from our data, is #1 diagnosis. We pay claims for it. Over 70% of outpatient visits is because of malaria. Prevention, care, and follow-up. How do we do this malaria insurance? A patient feels ill, and we have a collaboration with pharmacy stores all over Nigeria. And then he goes to the closest pharmacy, an outreach center. He gets tested with the RDT, rapid diagnostic test for malaria, to do a malaria parasite test. And once it's confirmed, he gets his drug delivered at that pharmacy, or if he's in a hurry, it could be dispensed to him even by our dispatch riders. And then, of course, he gets well and follows up on telemedicine with our doctors or the other end. So this is an innovative product costing only just $450 per month. In summary, we just wanted to know that innovation is what will drive universal health coverage. The Abuja Declaration must be enforced. Even the National Health Insurance Act that was just passed last year, May 2021, to make mandatory health insurance compulsory for all Nigerians will only work when they can have equity, when everyone, regardless of their pocket, can have access to quality health care, when we can reduce the out-of-pocket payments, which is over 70% now, and people can have access to health insurance, which AXA Mansard is providing. And this is all about AXA Mansard all over Nigeria. And we are not just AXA Mansard Health, we also have AXA Mansard Insurance and also AXA Mansard Investments, with over 153 employees worldwide, and income and earnings are also there. Thank you for listening.
Thank you so much, Dr. Jadesola. It was really interesting to hear that you could get all of those services for 450 naira. Please have your seats. I would actually like to ask you a bit more about that, maybe just after the presentations. But that was really interesting. I think that would be a really great package, right, for the informal sector. And I'd like to hear your thoughts on how you're really targeting them. So next, let's welcome Dr. Tolulope Adewale, who is the Managing Director of the NSIA NetSec.
When it's midday, it's difficult to say whether it is good morning or good afternoon. So it's 12 noon, and what do I say? Good morning or good afternoon? Both of them. Thank you very much for this opportunity to speak. I would like to acknowledge our wife, Vivian, for the work she's doing, and also my Egmont, who has been a rock of support for a very long time, even from when he was commissioner, and also member of the Presidential Action Committee on Health, Dr. Jude Idris. Thank you. And to the people on the panel who, for one reason or the other, in the course of my life, I've worked with the two of them, other person on the panel. So I would just want to speak at hopefully very briefly on future of healthcare and what we've done at the NSIA. Please, could you? Yes, I know. How does it move? Okay. Despite that the lighting is poor and the presentation is not very clear, please can you all see the presentation? So I will just start, just in case. Please just listen to what I have to say. So I'm from the Nigerian Sovereign Investment Authority, and as we heard, we are the investment arm of the Federation, not the federal government, as people tend to say. We're owned by four owners. We are four owners. One, the federal government of Nigeria. Two, the 36 states of the Federation. Three, the 774 local governments and the Federal Capital Territory. And the healthcare is a focus sector for the NSIA, and to be able to drive this, the NSIA established a company called the NSIA Healthcare Investment and Development Company in 2018. And we have three prongs of approach. We work with both the private and the public sector, and this we have done. I'm sure many of you know Evercare, and Evercare is one of our private sector investment through a fund called TPG, and also through in pharmaceuticals, through Verod, we've invested in EMSA. But in the public sector, which is one area where we've made demonstrable project and investment, where we have three core areas in which we used to operate three vehicles. One is single specialties, where we take area of focus. And in Nigeria, we actually invested in three areas: cardiology, orthopedics, and oncology. Now, I paused because I said oncology because I think that's what we're known best for. And then the second prong is diagnostics. And we have 2 diagnostic centers, one in Kano and one in Umuahia. And our cancer center, which is the flagship, is in Lagos, which is called the NSIA Lute Cancer Center. And also the third prong, which coincidentally, the special advisor to the president and the coordinating minister of health and social welfare mentioned, is medical manufacturing. And that's an area in which we will be talking about. Another area, which is something that was probably not in my presentation, is that we are actually intervening in another way to bridge the gap. And what are we doing? We just set up a new company called Equity Systems with the aim of looking at the private sector intervening by leasing equipment. And what that does is that the whole objective of that is to take the burden, we take the capital hit, and then over time, the private sectors can then begin to repay. So So, like I said, we have 3 demonstration projects. The NLCC, which is the NSIA Lute Cancer Center. Prior to making this investment, there was only one epileptic linear accelerator in Nigeria, and it was in the National Hospital. And we made this investment in 2019. And between 2019 and today, that center has attended to about 10,000 unique patients. But that's not the success. The success is we've been able to catalyze and to demonstrate that this is doable. And today in Lagos, you have another center, the Maseru Cancer Center, that has taken off as a result of that. In Calabar, you have another center called the Asiupo that has taken up. And even in the public sector, you have the University of Maiduguri Teaching Hospital. The Kano state government has built a center, and I know about a few other states. So as we speak today, between 2019 and today, I think from one epileptic, a linear accelerator, to about a total of 14 linear accelerators in Nigeria today. For us, that is the real success. Making the private sector to see that, look, this is doable, and the private sector has keyed into it, and that is growing. Now, what are we even doing for us as a sector in talking about impact? Now, we provide not only for and we set up in places where it is the bottom of the pyramid that will be able to access care, and that is all we're trying to do. Because we will go to places where it's not profitable or commercially viable for the private sector. We're setting up in Nguru. We're setting up a diagnostic center in Nguru in Yobe State. If I ask here, which of the private sector will go to Nguru and set up? So that is some of the things which we are trying to do and the way in which we are bridging the gap. So the impact of what we've done and what we're doing is that, one, access to care. Now, we've been able to liberalize access. I've told you about the 10,000 unique patients. Imagine if those 10,000 unique patients have had to leave this country. Think about the impact in FX, but also think about those who probably would have not been able to afford the money. What will have been their hope? They will have been dead. And that for us is important. But beyond that is even training. Now, just by the end of August, we organized the first oncology summit, where we brought every teaching hospital that has an oncology service and the entire value chain, brought them to Lagos, got external trainers, and began to say, look, as a country, let's begin to have a new way, a new approach, and have a standard of care. That for us, training and rebuilding capacity. And people are leaving. Coincidentally, in our centers, we have the highest concentration of oncologists in Nigeria, in West Africa. None from 2019 to today, not one has left the country. And so it is possible to make things viable and workable in Nigeria. So, employment and economic effect. then entire value chain. So now you have people who sell the drugs, who bring in the drugs, at least now they know that they have a market. And so the entire value chain and the economic activity is being driven. Now from 1 linear accelerator to 14, think about the number of people that have been employed. And as we scale from having 2 diagnostic centers to 25 diagnostic centers across the geopolitical zone, from 1 cancer center to 4 cancer centers, 1 in the west, in the east, in the north, and another 1 in Abuja over the next 3 years. Just think about what the economic impact of that is for those who will do the maintenance and for those who will even supply the drugs and the entire value chain, people will be employed. That is the impact. So we make impact investment, and for us, that's why we believe we can contribute to liberalizing access to care and contribute to achieving universal health coverage. Thank you.
Thank you. Thank you so much, Dr. Aderoli. Thank you for sharing key insights from the NSIA's work. Finally, please join me to welcome Dr. Jide Idris, former Commissioner for Health of Lagos and a member of the Presidential Advisory Committee.
Can I say good afternoon, everybody?
Good afternoon.
And let me thank Vivian for inviting me. She invited me just 2 or 3 days ago. But interesting, my role here, I sat down there listening to some speeches, the minister, the special advisor, and interestingly, Dr. Ogbuyi, PAMSEC Health, and a couple of other things I've had discussions with. My own job is going to just go back to history. And there's a coincidence. I came into this sector in 1999, and then the governor of Lagos State there was the president, is now the president of the country. So it's interesting. When I came into Lagos to the ministry, looked at the ministry for a couple of periods, and we just decided, then I was PAMSEC, and the commissioner was Leke Ikpito. We took a decision that there was no way we could operate with this system, that the system needed to be transformed. And luckily, the governor then backed us because his mantra was, anywhere where the private sector can do better, just move in. So we went through, there was no process because we didn't have the time. We tried all sorts of things. The idea was, take the plunge, learn your lessons, and review later and make progress. And this is what I've seen this morning. But when we started, we tried all sorts of things in the sector. Resource mobilization. We partnered with private sector in all the things we did, starting from financing itself. I'll come back to that later. Financing resource mobilization, we said free health. People were laughing at us there, but the idea was getting some other sources of funds to fund the health sector. We did the health for a couple of periods. We realized the challenge we had and the mistakes we made. We learned lessons. In service delivery, we tried something like joint venture participation in the pharmacy division. Very little things in the system there. And what we realized was that there was a drug revolving fund we had, which was not revolving. So we started bringing the private sector, give them space in the teaching hospital, let them bring out the drugs they want to have, and they should not go beyond the particular charges. Within a month, we saw the progress that the private sector could do, the amount of money that came into that. We tried in mortuary facilities. You see some mortuary facilities in Lagos now, run by the private sector. That's why we started them there, because we know that public sector could not run those things again. In infrastructure, we did all that, equity participation, just hospital facility maintenance, etc. We use private sector. In construction, look at the BT Olatiru Diagnosis Treatment Center in Lasso there. We use the private sector. We tried the cancer, cardiac arena center, although that's moribund now, but the idea was to get the private sector to do some of these things. We looked at the insurance scheme thing. Lagos State came out the first law that made insurance mandatory. And we said that service provision was both public and private. And how did we start then? Before then, we did community-based health insurance schemes, the pilot schemes, look at local government council, look at facilities. It's a collaboration between the local government people, the private sector, and state government. The local government brought out the facilities. We got the private sector to renovate, provide their services in this, and government was supposed to come from financing. These are things we try, even prevention. Malaria control program, indoor residual spray, larvicidin. We brought in private sector to provide chemicals and that kind of thing for us to do this spray. So we realized the value of the private sector then. But the point is, we are doing so many things because, again, you have to fight the culture in the civil service. They never liked it. But that's what the interesting part is. You needed to be consistent. And the lessons we learned were that, one, the culture of civil service is wrong in some aspects for the private sector, so you needed to change it. Government was not investing in the health sector. We needed to tell the government what to do. So there's so many lessons we learned. But the fact is that the government has to create that enabling environment. You heard what the minister said. It's interesting. And linking it to what Dr. Oboye said. In fact, he mentioned access to finance. This was said about 8 years ago in Lagos State. But because of the culture in civil service, the matter was killed, but now they've decided that, oh, it's very interesting, they're going back to it. So I've tried that history. There's a need for the private sector in this. We build it. Government has a role to play. You create that enabling environment. And one thing we realized at the committee level was that governance is a major issue in this environment. Governance. If we don't get our governance right, we'll not be talking, nothing's going to move. Government has to provide that enabling environment for the private sector to thrive in terms of legislation, regulation. One thing we did say again that you had the laws, you can come again, but the sanctity of contracts. You can sign a contract today, and tomorrow you go back to the ministry, the thing has changed. That is not encouraged to the private sector. But I see progress here. Looking back and see where we're going, there's a lot of progress, and Nigeria is going to make Nigeria is going to be better for it. I thank you, but I'll be willing to share some of this.
Wow. Thank you so much, Dr. Idris. Thank you for giving us that rundown of the history and some of the key lessons learned. I will come back to you for additional questions. I see that people are already engaging. I see your comments. I see your questions. We will come to you. But before we come to the audience, I'd just like to ask each of you one question, if you please oblige me. And I would like to start with Dr. Jadisola. So you had mentioned, you really went into detail about how the public financing system, or how the federal government has never met the 15% Abuja declaration. And even though we know some states are meeting it. And I'd just like to hear your thoughts. Maybe anyone else on the panel who wants to contribute to that. And maybe actually specifically, maybe Dr. Tinola as well, and Dr. Tolope. How can private sector help, for lack of a better word, inspire and drive federal investments in health? So how do you get the federal government to increase investments? Are there ways, are there instruments, are there partnerships that could help drive that? Are there counterpart funding arrangements that could help push that? And Dr. Tinola, when you're responding, could you please speak to how exactly Bishan has helped build trust from your perspective, driving private sector investments, and then Dr. Tolope as well, from your perspective, using funding from the Federation to help boost private sector healthcare systems? I feel like I've said a lot in a very little time, but you could just respond in 1 minute each. That would be great.
All right, thank you.
The other mic.
Oh, okay, sorry. All right, financing, like Dr. Idris rightly said, creating the enabling environment is so key. And once the government makes policies and puts in the right governance structure, then the private sector can thrive. And the policies and the regulations are also in place. The regulator, our regulator, NHIA, is also on top of it, regulating the practice of HMOs and regulating the providers, accrediting them appropriately, due diligence being paid. Now, when we have the quality of care standardized and available to the people, then we have a thriving and enabling environment for everything to thrive. Now, premium financing is actually an innovative way that we have found to work, where fintechs come in, where banks, we have a lot of collaboration with banks, starting with GT, Sterling, and the rest, and also some fintechs that also help to provide some form of microinsurance. So when people cannot even pay, we also have telecoms partnership with Airtel, where people can even pay with their data, buy data, and then pay this microinsurance product. So they can't pay the bulk sum for the corporate plan, but they can pay $450 per month. They can't pay the bulk sum of a very big plan, but they can pay $1,000 for AXA Pass scratch card and have access to healthcare for 1 month, and over the month, $12,000 for a whole year. So with those innovative financing methods, also we have quarterly payments that can be made. We have a digital platform that people can make payments quarterly when they can't even do it whole lump sum. So basically that has simplified the payment and made it easy for them. But in collaboration with government, I think the enabling environment is so key. And of course, helping the sector to grow and thrive by regulating the providers, the HMO practice. I mean, we have over 60 HMOs, but we have a lot of issues with the practice, even with the regulator. Now we have launched the operational guidelines for the NHIA Act, and I know Lagos State is also on it, and many states are also planning to launch out. But we need appropriate regulation. I mean, when we say mandatory health insurance, how is the regulator going to make it compulsory and get all the SMEs, all the companies to ensure that all their staff are on health insurance and everybody is covered regardless of their status, whether they're the driver or the cleaner in the office? That is important. So we need that regulation to be firm and to be enforced appropriately.
Thank you. Thank you so much for sharing those. Dr. Tini?
So I think, to be honest, I'm not really sure you can mandate the public sector to work with the private sector. If we look at PPPs, it's all nice to have the legal agreement, everybody signs, you know, using counterpart funding as an instrument. But I think it's more important for the public sector to come to the realization that healthcare is an income generator. Not to look at it as a cost center, but to look at it as a potential valuable contributor to the GDP of the state, of the region, and of the country as a whole. The Abuja Declaration was for 15%. Arguably, I can identify 1 or 2 states that have made a commitment to increase by 1% every year, some at about 10%. But if you look at the cross-section of Nigeria, look at all 37 states, I don't think up to half of the states are doing 5% of their consolidated budget towards health. So we as an organization, PSHAN, we've found out that by engaging, you know, by trying to build trust, but also we're demonstrating by having programs like the Adopt a Healthcare Facility program, which we have launched, which is a proof of concept to show that with even the money that you have and the community buy-in, you actually can do something, you can achieve something. So I do think all stakeholders need to be involved. You can't mandate either side to do something. They need to understand the infinite benefit to themselves as well.
Thank you. I hear you. It has to be seen as a business case. And I think, exactly. Dr. Adewale, you already spoke a bit to that. Do you want to respond at this point?
No, if it's not necessary.
Oh, it is necessary. Always necessary.
Okay, so like I said, what we've done is that we've demonstrated that, look, things can be done, and our role is to do interventional investment. And is to go, because we've got patient capital, and that with that we can provide access through the funds that we have. We do not give grants. We do not do CSR, but we will make investments in a way and run it in a way that it's sustainable, in a place where the private sector will ordinarily have found it difficult. And that's because we wear 2 hats. On one side, we're very private. On the other side, we're government. We're public sector. So because of that, we've been able to blend that, and it's very easy to mobilize capital from DFIs to then help us and collaborate with us for us to then increase access, which is the most important thing for us is to be able to increase access across the entire country.
Yes, thank you so much. So what I'm really hearing from both of your responses is that it's important to be able to communicate with both sectors. So you said you're both private and public, and understanding what the value case is for each of the stakeholders is important. And I think that is really a lesson to learn. And I found it interesting that you also work across all the 3 levels of governments, local, state, and federal. And if you could please share, for example, because I found that that is new information to me, that the local governments councils are investing in this fund. What would you say are the key lessons for getting local government involvement? We know that primary healthcare, for example, is supposed to be primarily the responsibility of the local government areas, but states and federal governments have had to help boost investments in that in the primary healthcare sector. What would you say the key lessons are for galvanizing interest in investments at the local level from your work at NSIA? And if Dr. Idris could please share some, because you also mentioned working with the local governments while you were commissioner.
Was that for me?
For you and then Dr. Idris.
Okay, so let me, maybe I wasn't very clear when I said that we are owned by a business. So our money comes from what we ordinarily would have called excess crude account. Mm-hmm. So we get a direct vote, and then we give each of the segments, they have an equity. So it's like you have shares in a company. So that's how it is. It's not as if we tell each one of them to make a capital call. Mm-hmm. That when we want to make an investment, look, I'm going to bring money. No. Mm-hmm. So because the money comes directly from the federation, so that's how it is. And then
right.
But so let me say so there are 3 ring-fence funds of the NSIA. Mm-hmm. There's a future generation fund. There is the stabilization fund, and there is the Nigeria infrastructure fund. So if you remember during COVID, when the government was almost going to go broke, but there was no money to share. Yeah. The federal government, during FAC, reached out to NSIA, and from the stabilization fund, we were able to release $150 million to the government to then be able to share across the 3 lines. So that's what it is.
Great, thank you. Good to hear how the local government is involved in that. Dr. Idris?
I'm not too sure what you want me to talk about. But let me say, from your initial conversation, I think from my experience, we assume that people in government know what to do, especially whether the president or the governor or the local government chairman. They don't. And that's why it's very essential for the technical people, the private sector, the people who know must create a way to get this information across to them. We can change their mindset, they will buy in it. We were lucky in Lagos, it says that the governor then appreciated the role of the private sector and listen to us. You cannot do this, you cannot do that. But again, you had these politicians who can create problems for you. However, at the national level, we did say that governance is an issue. Each level of government has its own role and cannot force certain things on it. Even the federal cannot force the state governments to do certain things. However, there is a commitment by the federal. They must be able to find a way, collaborate with all the other levels of government, because they are running the system. There must be a pathway, and that requires collaboration, education. So that's what we're telling the federal government. You have to go down to the state, get them involved in what they are doing. Take, for instance, the NHIA guidelines released 2 days ago. Interestingly, there will be people now who are not happy with it because it's not supposed to be a perfect government. It cannot be a perfect document. But every time you keep look at the progress and review and continue like that. But like I said to them, you can stay at that level of care there at the federal level. The implementation at the state and local government level. If the people do not even understand what you are doing, so this is where advocacy comes in. You can blow the grammar at that level of care. The people must understand what you are doing. If they don't understand, they can never gain your trust to even change the system. Yeah. That's where, again, that advocacy comes in, enlightenment comes in, and the private sector too has a role to play in some of these things. I don't know if I...
Yes, you did. But if you could please add something about governance. You spoke about how civil service culture affected some of the reforms you were trying to implement in Lagos State Ministry of Health. What's one key lesson can you maybe share to help shift that culture?
Governance is multidimensional. It involves regulation, it involves legislation, decision-making processes. These are the things we take for granted here. But if you don't have regulations, there's going to be chaos. If they have legislation, there is no way anybody can even appropriate money for you to do what you want to do. Legislations, laws define the way you do things. And there are so many things like that which we take for granted, we don't even consider at all. Simple processes and procedures in our clinical service. Take for instance, clinical processes. In most of our hospitals, we don't even consider them as serious. It's only people who trade from that area who understand that. These are the things today the private sector has to imbibe here in a system to give to us. So, health literacy. We talk of people do not even understand what we're talking about. So you need to get people who understand the people at the grassroots and talk to them their language. They will understand precisely what you want to do. There is hope, but there's a lot of work to do.
Thank you. There's hope, but there's a lot of work to do. So I see there are quite a few questions already online, but before I go to that, I will make time for one question from the live audience. Is there any one person who has a question for my panelists? One person? Anyone? Or are all your questions on the platform and I should just go there? Okay, great. Okay, I see one hand there. Can we get him a mic, please?
Thank you. Tangana is my name, and I'm from an institution called Babcock University. My question is very specific. How is the private sector, and this question can be answered by any member of the panel, how is the private sector translating her experience to make sense to the local person? And the reason why I'm asking this question is the informal sector makes a bulk of the system that we are talking of where the problem lies. And it appears, by my experience, that the informal sector, as far as that sector is concerned, the private sector is something else, is out to make money. But the private sector actually has the interests of the informal sector at heart. So how do you bridge this gap for a better service delivery? Thank you.
Okay, thank you. Dr. Jaisa, do you want to take that?
Yes, thank you. Informal sector is actually where the population is. And if we want to achieve the universal health coverage, we must reach them. Now, I'm sure we all know how many of our people, the Nigerians, access healthcare, especially with dwindling funds these days. So, right there in the remote villages, there is a pharmacy shop there. There is a patent medicine store. There is a man, there is a TBA, traditional birth attendant, that takes delivery for all the women. We are now collaborating. I know Lagos State to start a program of educating them and getting them, because now we can't get to those remote villages. We don't even have enough personnel, and every day they are going to the UK, to the US, and leaving Nigeria. So even the few that are remaining are not able to reach out to all the 220 million. So now collaboration with the TBA, training them on hygiene, on asepsis, on keeping things pure and better so that we can reduce the sepsis or things that happen when they take deliveries at home. So we're educating them, and of course educating the population too, through different means. We have in Agza Mansard, emerging customers, a committee and a team that actually reach out to the informal sector. Right now, we're dealing with the NURTW to see how we can educate them, reducing the road traffic accidents, and teach them on, driving issues, education and literacy on keeping safe on the roads. Beyond that, all the other sectors, especially the pharmacies, in those remote villages, we have collaboration with them, which is why we have partnership also with pharmacy stores, and we educate them, we have trainings. And especially these are emerging customers team, we're reaching out. We have this brick and mortar model that we're building. Beyond our malaria products, where people can go to pharmacy, we have partnership with pharmacies where people can be diagnosed through telemedicine